A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
We put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
And good afternoon and welcome to the Therapy Hour. Thank you for joining us. This show is brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And we are in summer mode. Back to school is quickly coming. It's about 7 weeks away. We're about halfway through. Most of these kids all around the country are going to be re-entering a school environment that is going to be demanding, stressful, constant. There's going to be assessments, homework, and sometimes these kids, they don't adapt well right away. I mean, and parents usually don't find out about this until probably late October when they have teacher evaluations and parent meetings, and then they find out the status of their child's performance during the school year. So, these kids, some kids are going to struggle with learning difficulties. They may have some difficulty with learning, behavior, attentional issues, social skills, emotional regulation, and it may requiring testing to see if there's a learning difference or other condition that may be affecting their well-being. And so parents may not actually see this at home, but a teacher may actually point it out. And behaviorally they may seem fine, but then there may be performance issues, or you may see some anxiety. So I want to read you a statistic from the National Institute of Health that actually it's estimating that there are as many as 15 to 20% of Americans in this country are affected by learning disorders and emotion disorders. And it's actually saying that there's an estimated 4.6 million children, school-age children in the United States that have been diagnosed with learning difficulties. So joining us today is Dr. Michelle Luery from Pediatric Neuropsychology Services, and she's going to help us understand, what do you do about this? So how do you find out what your child needs and what's going on with them? It requires a special kind of evaluation. And it may not be an evaluation that the school is going to provide, and it may not be enough. And how do you differentiate what a school evaluation is going to give you as compared to a specialized evaluation that's going to tell you exactly what's going on with your child? And parents may have a hard time hearing what the outcome of these kinds of evaluations. It's called neuropsych testing. Neuropsychology is evaluations. So what I'd like to do is say hello to Dr. Michelle Luery. Michelle, hi.
Hi. Thanks for having me today.
Yeah, thank you. Thanks for coming on to the show. So you've been doing neuropsychology testing for how long?
Wow. Probably 17, 18 years now.
17. So that's quite a stay.
Right.
Have you been in the Dallas area the entire time?
And most of that time.
Most of that time.
Yeah, since I did my postdoc.
Wow. Okay. Well, here's what we're going to do. A lot of families don't really know what neuropsychology testing is. Can you tell us what neuropsychology testing is?
Sure. So a neuropsychological assessment involves a very comprehensive assessment of a child's functioning. My job is to look at the child as a whole, from top to bottom. So not only learning, but also psychological functioning. So this involves IQ testing, achievement testing, looking at academic functions, looking at attention and executive functioning. And executive functioning is something important that we should talk about. Language, visual spatial, sensory motor. It's just a very comprehensive assessment of a child's functioning, and also involves a thorough assessment of a child's psychological and social functioning.
Because, you know, when you think about school statistics and performance, it's not always that they're not comprehending or they're not processing well, but there could be something underlying going on with these kids.
That's right, which is often misdiagnosed.
It's misdiagnosed, it's overlooked, and maybe it's overdiagnosed. It's you know, quick to kind of jump on to conclusions and saying, well, this kiddo might have ADHD.
Right. Very quick. You know, so many kids come into my office and the parents think they have ADHD, and they truly do not have ADHD.
And you know what's interesting about attentional issues is that you can actually have a child can actually experience attentional issues with true ADHD, with mental processing delay or disorders. Then you have anxiety. It can also affect attentional issues. Sensor integration, dysfunction can also affect attention, and so can depression.
Right, and very often that is what what the child is coming to me for that differential diagnosis.
So that's what's called the differential diagnosis. So you can actually find out like what particular category they seem to kind of be deficient in.
Yeah, so it's really teasing apart the different parts of that child's psychological and neurocognitive functioning to say, what is it?
What is it, and what is it actually diagnosed? So what types of disorders are typically assessed?
Well, you've mentioned some of the more commonly known disorders: ADHD, anxiety, learning disabilities, depression, and certainly I see that. I see several kids come in with concussions, and you know that's something that people are becoming very, very aware of right now, the impact of concussions on children's functioning, generally through sports. More severe head injuries. I see kids who've had cancer and have had various treatments for that, and we're looking at the neuropsychological impact of those treatments. Autism, Asperger's disorder, and more complicated psychological problems.
More access to, we're talking about maybe more personality disorders.
Yeah, and our kids are kind of young, so it's very rare that I'll diagnose a full-blown personality disorder in a child. But I'm thinking more of a complex mood disorder like bipolar disorder, where you know a child might have been misdiagnosed as ADHD, and then medication makes him or her worse.
That's putting gasoline on the fire if you get that one wrong.
That's right, and very often it is misdiagnosed.
And that's a really testy population. Also, is dealing with children and in a very hard-hitting diagnoses, such as bipolar. And you and I were actually were visiting a little before the show started about how much responsibility there is in an assessment like this. How it can set the tone for a child's life.
Yeah, and you know that also though from a positive way. That's why I deal with kids. There's so much you can do. They've got their whole life ahead of them.
Yeah,
to make change.
And so when you do this neuropsych testing, what's the purpose of it? What are you hoping to get out of? What can a family expect to get out of a neuropsych evaluation?
My goal is to, as we said earlier, tease apart those factors that are impacting the child, whether it's one diagnosis or multiple diagnoses, but to, as you say, to get it right, and then to make appropriate interventions, to refer them to the right person for medical treatment or psychological treatment, OT, whatever it is they need.
Yeah, so that they start getting the early intervention treatment that they need. Because if you overlook these things and like you feel like maybe they just need a tutor, and you're not being overly concerned or being too, laying a lot of importance in how much is going into how your child is doing in school, you can miss a window of growth.
Right. Yeah.
An opportunity to grow and learn.
And really, sometimes it's life-saving. It changes the entire track for that child, and pulling them from one school, putting them in a different school where they need to get separate services.
Yeah. And so the purpose of getting a diagnosis then is not only for getting the appropriate treatments, but also making sure that, you know, if there's medication involved and they need treatments, that they can actually look into the right resources as well.
Right. And I tell the parents I will only send them to people that I would take my own children to.
Yeah, and that's a really good point, because I think that it can get really scary, and some parents may not be ready to hear what you have to say, and that's a conversation we had yesterday. But you have to deliver the news that sometimes when these assessments come out, it may not be what they were expecting, but it's something that definitely needs to be addressed with the child.
Yeah, I mean, it is. We spoke about it being a grieving process for the parents to recognize that something's wrong with the child. But most often by the time they get to me, they know something is off and they are ready for answers. And they, as hard as it is, they're putting a lot of time and a lot of money into this process to get the answer. And they know that I'm not there to protect their feelings. I'm there to be an advocate for their child.
You have a job to do, and that's to make sure that you're defending this child, not only in the sense of what their needs are and what their capabilities are, and identifying that, but also delivering the news. And I keep repeating that because I think it's important, delivering the news that this is what your child needs in order to be able to be effective and be a productive kiddo in the world. And it'd be quick. Kids can quickly fall behind in school when things aren't diagnosed right. Well, I'll tell you what, we're going to take a quick commercial break. When we come back, we're visiting with Dr. Michelle Luery, and we'll be right back after these messages.
Not available in all states.
Whoa, what do you have there?
It's a Reese and Irvy's frozen yogurt. We just had our robot make one.
A robot made your frozen yogurt?
Yes, from Reese and Irvy's, the world's first fully interactive robot vending machine that serves 9 flavors of delicious yogurt with 6 amazing toppings. And it's available for an exclusive franchise opportunity.
Wait, you mean I can own my own frozen yogurt robots?
And make money at the same time. These robots are the future of frozen yogurt franchising. They can be placed almost anywhere and operate 24/7. Malls, theme parks, grocery stores, you name it.
A robot that serves frozen yogurt. That's revolutionary.
Exactly. Reese and Irvy's Froyo robots are taking the market by storm. No more messy yogurt bars, long lines, or do-it-yourself machines. Just delicious frozen yogurt in 60 seconds or less. Anytime, anywhere.
How do I get my own Reese and Irvy's robots?
It's easy, but you better act now. Locations and machines are going fast. Just go to froyofranchising.com. That's froyofranchising.com. Check it out now. froyofranchising.com.
Ace is the place with the helpful hardware, folks.
I love my Craftsman tools, but so do my kids and my neighbors.
I told Brendan, when his Craftsman tools disappear, come see us at Ace. We've got Craftsman hand tools, power tools, accessories, mowers, everything.
Ace is the place with a ton of Craftsman. Ton as in a lot. We've never actually weighed everything.
Now through Monday, come in for the Ace 4th of July Craftsman sale and get the best prices of the summer on select Craftsman products. Offer valid at participating stores. Store stock only. See store for details.
A Napa guy knows the only way you'd give a freshly minted driver a brand new car is if he promises to never drive it. Instead, let him grind the gears and knock over the neighbor's mailbox in something a little more suited to his skill level. And with over 400,000 parts and a little Napa know-how, he can safely drive something that's nearly as old as he is. It's not perfect, but it's perfect for him. That's Napa know-how.
In small towns and big cities around the world, Habitat for Humanity volunteers gather. Hammers are raised, bricks are laid, and another family finds shelter in a home they help build. Habitat volunteers are changing lives for the better, and in the process, maybe even their own as well. Support the work in your community or wherever your heart leads you. Volunteer, get involved, and help build it. Visit us at habitat.org.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, we're back. If you were just joining us, we're visiting with Dr. Michelle Luery from Pediatric Neuropsychology Services in Dallas. Sorry. In the first segment, we established what a neuropsych evaluation is, and what it can do for your child, as far as like knowing when it's time to get help and figuring out exactly what's going on. But we're going to actually get into a little bit more detail as far as like what is involved in testing and neuropsychology evaluations.
Sure.
Tell us a little bit about that.
Okay, so let's differentiate a neuropsychological evaluation from psychoeducational testing. Psychoeducational testing is generally the battery that you get through public school if you need your child to be tested.
So if you have an ARD meeting or 50, you're trying to discuss 504 or special education,
right?
They'll assess them.
Right. If you get them through that process of testing at school, that will involve an assessment of a child's intellectual functioning, academic functions, and a screening of psychological and social functioning. And it doesn't provide data necessary for really digging deep and understanding more complex disorders, even really ADHD, autism spectrum disorder, more in-depth psychological difficulties. So a neuropsychological evaluation is a much more comprehensive look at a child. From start to finish, looking at the child's psychological processes and cognitive functioning. So specifically, IQ testing, I like to use, most commonly given test is the WISC-5, the Wechsler Intelligence Scale. That underlies both a psychoeducational and a neuropsychological assessment. Then to that, I'll dig deeper and look at a child's attention. I use various batteries. I do continuous performance tests, which are independent, sustained attention measures. And then I'll do tasks like I use a battery called the TEACH, which is more one-on-one testing of attention. It's very important to look at higher level thinking, frontal lobe functions. Those are executive functions. And there's different batteries that have different subtests that I'll use for that. The DCAFs, the NEPSI, the TEACH, depending upon the age of the child. The Wisconsin card sort test. I like to look at the child's visual attention and auditory attention, same visual memory and verbal memory. Right now I'm really enjoying a battery called the CHAMP, which I'm using, but there's various batteries. I like to look at a child's language functioning, sometimes very in-depth, and I'll use the self, or sometimes just looking at some subtests, depending upon what our needs are. And then when we get to the psychological component, if the child's having true deficits in reality testing, we're really concerned about that child being grounded in reality, having a possible thought disorder. I'll do a Rorschach. Other times I'll do personality profiles, which are computerized, clinical interview definitely with the parents and the child. I do measures of attention.
Can you explain something really quick?
Sure.
Excuse me. The Rorschach.
Yes.
Tell us a little bit about how that works. I think it's just a really fascinating assessment.
Yeah.
And it's actually they've been using it for a long time.
Forever and ever. And I think it's quite controversial. Yeah. It's not my favorite test to do with every child, but it really is my favorite test to do if I think the child has a more complex mood disorder that might involve disturbance in reality testing. And you have to have in-depth training on the Rorschach to be able to interpret it correctly, because otherwise misdiagnosis.
So that involves looking at an ink blot.
Yes.
Correct. And it's in how many different there's no specific it's really no specific definition of what they are. It could look like a butterfly, it could look like a bird.
That's right.
But what you're doing is you're kind of taking an impression of how they are perceiving that, to get an idea of what kind of thought processes they're having, like how they think about it.
And sometimes it's truly bizarre. You can see a child's distorted thinking in how they see that and how they put parts of that blot together.
So if they say something that is disturbing, like that is a red flag for you.
Oh, absolutely. And there's certain things you look for in certain disorders. So there's certain things that I will be looking for in a child who is looking like they're depressed, versus a child who's looking anxious, or a child who's looking like he is psychotic.
Yeah, because of how they're perceiving the image.
Yeah, and certain words and themes.
Oh, interesting.
Yeah.
That's because they can actually, there's a theme of blood or theme of...
That's exactly right. Blood and gore is typical for one specific disorder that, just depending upon what comes up, it again leads me in a certain direction.
Do you think that, and this is completely a little bit different line of thinking, but do you think that maybe video games and playing gory video games could ever influence like how a child would perceive something like that?
I think it's kind of the chicken and the egg. Like, what comes first? Does the child watch those video games and then develop a disorder? Or does the child have that the predisposition towards disturbance in reality testing?
They're drawn to it,
yes.
in other words.
And that's a child who has difficulty socially engaging with regular children. And they're more likely to interact with imaginary objects. They might be more drawn to that. I always am very specific with parents about how much electronics time their children should be having, whether or not they have disturbances in reality testing or ADHD, and what type of content that should be.
I had a conversation with my son, Harrison, yesterday, and we were talking about the inside world versus the outside world. And you could be in a room full of people on their phone, and they're looking at their device, and they're doing something, and they're giggling, and it's something that they're inside of their mind, and so they're projecting something that they're seeing, and it's like they're not interacting with the outside world. Yeah. So there's definitely two distinct modes of perceiving, and I wonder if you spend too much time in one versus the other, if you have a predisposition for one over the other. Yeah, and that's why we see a lot of social skills issues and difficulty with interpersonal skills, because they haven't developed those skills, and it's like you have to grow them and mature the ability to interact with others. And if you're not practicing, then I wonder if that's something that might have an effect on them.
Right, and if it's so difficult for you to interact because you have a social interaction disorder, for example, Asperger's.
Yeah.
Now, Asperger's doesn't truly exist anymore in that name,
right.
But those symptoms are
high
still there.
High-functioning anxiety. They just changed the name, but
it's still an autism spectrum disorder,
sure.
really. That child has difficulty socializing, so will be more likely to want to spend time alone in his room playing video games, because it's much easier than being in that artificial environment of interacting with people, which doesn't come naturally.
And that's where their world is in the computer, mechanistic. It's tangible. They can see it, its colors, and it's
immediate reinforcement.
It's immediate reinforcement. It's all the gratification is immediate.
Yeah.
It's so interesting. So there's a lot going through your mind when you're administering these evaluations.
Yeah, and again, as I'm a parent, and my heart goes out to the parents I'm working with, because I understand what they're going through, and we are faced with a whole different world now with our children being exposed to all of these things.
It's completely different. I mean, just thinking about what happened a few days ago and what's on the news, and we had a conversation at dinner the other day, and we asked my kids, so what do you guys know? What do you think about what's going on in the world? And my 12-year-old daughter, she knew what had happened, and regarding the issue in Dallas, and it actually beamed up on her phone. So they're being exposed to a lot of these things, and we may or may not even know how they're actually perceiving it and internalizing it. So
that's right.
It's important to have a dialogue about things like that.
And actually, that is a question I've started asking my patients. When I'm testing, I'll set some time aside and I'll say, tell me what you know about what's going on in the world. What's important that's happening now? What do you think about what's happening in the world? Just to get a feel for where they are and how scary that might be for them, or if they have no idea what's going on.
Do you ever hear kids say ISIS?
They say ISIS.
I have a kid like that.
Yeah.
I have a patient like that now, and they're terrified.
Very scary.
Yeah, and that's something that's how can you talk something like that down, because it's reinforced all the time, and so it's now your word as a parent versus what they see on the internet.
Right. So and again, I'm not there as a therapist, so I have to be careful with that too, because I want to get the information what the child's struggling with, and then give that information to the therapist, if there is one, or if I make that referral, so that they know what the child is struggling with. That's a fear.
It is a true fear, and you also connect with the parents on being able to kind of say, hey, this is what your child said.
Yeah.
And they may be surprised to know how much you know about their child, because you spent the time to really visit with them and get to know them.
Yeah, sometimes a kid will say things during the testing that they won't tell their therapist. They might be seeing their therapist every week, but it's a different type of environment. They don't have to work through it with me. So they can tell me these really scary things that they fear, or things that have happened to them, and know that they don't have to sit and work through it with me right then, but they can unload it, or concerns they have about things that are going on in their family or things at school. So it's amazing how open kids are during this process of testing.
And you being a psychologist, I mean, you're there and you're equipped to deal with things like that when they come up.
And I kind of switch. I might start on something neurocognitive, then we switch to something psychological, then we'll just talk about the world, then we'll do something neurocognitive again. So it flows very well.
How many assessments are typically administered in a neuropsych evaluation?
Wow, so many.
Yeah.
I mean, I would say probably 15 different batteries. Typically, I would say I use 15 different batteries in an assessment, but I'm pulling subtests from the battery.
Oh, wow.
So when the parents come to me, I've already asked them to send through the background information forms, which they get ahead of time, and the rating scales for teachers and parents and the child. And I've looked through all of that before they even come in. So I have an idea of what the issue is. And then we'll spend an hour and a half talking.
So you're collecting information. You're not just going off of the information off of the assessments, but you're actually gathering information from people that have experience with these kids.
To me, it's the most important thing is to imagine the child in how they're doing in their whole world, not just in my office, which is an artificial, very structured environment. But I'd speak to teachers and parents. If there's neurologists, psychologists, psychiatrists, all of them, I'll get the information from them. And then collect all of that and have the in-depth hour and a half interview with the parents before I meet with the child. And then I'll meet the child on 2 separate days for about 3.5 to 4 hours a day.
Wow. Yeah, that's a great amount of assessment for sure.
Yeah.
We're going to take a quick commercial break, and we're going to come right back to this because we're on something really nice. I like this. Stay with us. We'll be right back after these messages.
Raise your hand if you think you know what identity theft is. Just kidding. This is a radio commercial. We can't tell if your hand is up. But we can tell you that if you think identity theft is when someone adds charges to your credit card, you're only partially right. Identity theft is when someone pretends to be you, to open new accounts in your name, or any number of other bad things. That's where LifeLock can help. We use proprietary technology to detect and alert you to a whole range of identity threats. And if you have a problem, our US-based team of specialists will work to fix it. You'll get more protection with LifeLock than you get from free credit monitoring alone. Obviously, no one can prevent all identity theft or monitor all transactions at all businesses, but LifeLock is the best identity theft protection available. Join LifeLock right now and get a special 15% discount off your first year. Visit LifeLock.com and use promo code 15OFF. That's 15 off to take advantage of an incredible 15% discount off your first year. Act now. Offer ends July 3rd. Go to LifeLock.com and enter promo code 15OFF. LifeLock.
People who can afford a LASIK procedure sure are lucky. Imagine being able to throw away your contacts and glasses. Imagine waking up tomorrow with 20/20 vision. Too bad everyone can't afford LASIK. Well, guess what? There's a company that agrees with you. The LASIK Vision Institute is now offering dramatically low prices on high-quality LASIK to make it affordable for everyone. That means you get the latest FDA-approved LASIK technology for a fraction of what others charge. And if you call right now, we'll schedule a free appointment so you can discover if LASIK is right for you. Results may vary. Call 1-800-700-6651. Even better, if you're one of the first 100 callers, ask about an extra 20% discount off our already low-cost services. We've already performed over 1 million procedures. Let us help you. Discover how you can get the quality LASIK experience you deserve at a fraction of what others charge. For your free appointment, call 1-800-700-6651. 1-800-700-6651.
Attention men under the age of 35. You know what really impresses the ladies? When a guy has a few drinks and later gets pulled over for buzzed driving. That could cost you around $10,000 in fines, legal fees, and increased insurance rates. There goes let's grab dinner and a movie. Oh, I know. You drive more carefully when you're buzzed. You've proven that hundreds of times. A woman admires that kind of confidence. And you've practiced how to speak if a cop does pull you over. Slowly, clearly, and politely like, "Good evening, officer." A woman admires that kind of foresight. And what woman doesn't find it adorable that you call it buzzed even though the law calls it drunk? You could kiss $10,000 goodbye, along with any chance of having a girlfriend. Because nothing says, "I'm a catch," more than a guy who lives in his parents' basement and calls it my place.
Buzzed, busted, and broke. Because buzz driving is drunk driving. A message from the National Highway Traffic Safety Administration and the Ad Council.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, and we're back. Thank you for joining us. If you're just tuning in, we're visiting with Ms. Cheryl Luery, Pediatric Neuropsychology Services in Dallas. And we were just discussing the neuropsych evaluation for kids and what all it entails. There's testing, there's information gathering from a parent, from teachers, from outside resources. There's communication with the child. And then there's the interpretation of the testing, and then the consultation with the parent. Mm-hmm. But you're a clinical psychologist, so you're licensed as a clinical psychologist, but you're a neuropsychologist as a specialist. Mm-hmm. So what differentiates that? How do you become what is a neuropsychologist versus a clinical psychologist?
Okay. And I think that's really important. A clinical psychologist can technically do neuropsychology testing, that they're capable of picking up that test and administering it. But they don't have the specific training to interpret the results. So I got my doctorate in clinical psychology, but my dissertation was in neuropsychology. It was the neurocognitive effects of chemotherapy in kids with leukemia, and went on to do my postdoc in neuropsychology. So I then became boarded as a neuropsychologist, and that's about a 1 to 2 years process where you go through a written exam and an oral exam by a board of neuropsychologists. And now I am a neuropsychology examiner, so I examine other psychologists who want to become boarded as a neuropsychologist.
So you're an instructor in some regards, yes?
Yeah, well, more of an examiner than an instructor, yeah. Mm-hmm. So I think it's really important that you know what these tests involve and what they mean, rather than just administering it or having someone who's just got who's not trained as even a clinical psychologist administer the testing, and you just get the scores.
So I know in my training, we learned about assessments, and we did an extensive amount of testing and learned how to interpret and also write up a report. Mm-hmm. But that doesn't make me it gives me the ability to do so, but I'm not I don't have the certifications to really call myself an assessor. It's the same thing with my licensure. You know, I'm a counselor, and I do cognitive behavioral therapy as counseling, but I'm a biofeedback specialist, and that means that I've actually had to meet a certain criteria, had to go take courses and supervision, take a test, and then be a part of a board-certified organization for biofeedback.
Exactly.
And that's kind of what is happening here.
Yeah, there's national and international neuropsychological societies, which I'm a member of, and I attend those conferences every year. And then I am boarded through the American Academy of Pediatric Neuropsychology, AAPDN, and we have a national conference in Vegas every year.
So that's a nice conference area, isn't it?
Yeah.
My wife and I actually went to a conference last summer in Vegas, and I was
you?
like, hey, we should do this a little more often. It's kind of cool.
It's kind of fun.
Yeah, nightlife definitely can be very fun. So in being able to kind of have that evaluation, so people trying to find a neuropsychologist, you don't just get on the internet and look for somebody who assesses, but you want to kind of find out and make sure that they're the right kind of professional.
Right. I would say if you're calling a psychologist and wanting an assessment, and you know that you want a neuropsychological assessment, not a psychoeducational assessment, you would want to ask, are you boarded as a neuropsychologist? Because I think that's either yes or no, and there's your answer. And it's also important to me to make sure that the person who tests your child is the one who actually tests your child. So I do not have a psychometric assistant who would administer the tests for me and give me the summary of scores. I am with that child from the first time they're in my office till the time they leave, and I watch them go through the process of testing.
I think that it's very good because there's probably a lot of nuances that occur during testing that are significant. Mm-hmm. And if you have an assessor like a psychometrist that's actually administering those things, they may or may not pick up on that, or they may not it may not be interpreted.
Right.
It is, their skill level, being able to understand and recognize certain things may not be as sharp as your own.
Right. And to me, the scores in themselves don't matter that much. It's the process that the child goes through to get that score that is more important. And how they react and their facial expressions. And if they have tics, do they tick at that time?
Yeah.
There's so much, a wealth of information you get from observing the child as they go through the test. So the test itself is it's just a tool that you're using to learn about the child. That ultimate score is not the most important thing.
Yeah, and because you're actually seeing their performance. Are they having anxiety? Is there low frustration tolerance? Are they getting angry? Is their attention span not really present? So you're not really relying on the measures to give you that information. You're actually observing it.
Right, yeah. It's that relationship between you and the child that you have for those 8 hours over 2 days that allows you to pick up on those subtle struggles that the child might be having.
Super important, because you want to know the child, and if you're going to administer it, give information about your findings, and you really want to know, what this child has been through and
Right.
where they're at.
And also, I think you want the child to be an active participant in the testing process, not just sitting there thinking, oh, my parents are making me do this, but know that they're there for them. So I introduce it as I am kind of like a detective. My job is to learn about how your brain works. And I remind them the things that they're good at, that their parents have told me, like soccer or gymnastics. And I say, but we all have struggles, and we're going to figure out what those are for you so we can make sure that next school year or the rest of this year is a great year for you. And if there's anything different that your parents or teachers or whoever can do.
Yeah, I mean, you may need a smaller group for testing. You may need additional services for handwriting, spelling, and additional math help. So all of that can be determined from those tests. So when a child goes through neuropsychology evaluations, how long does it last? So is it done in one day?
So I meet with the parents for an hour and a half, and then I meet with the child 2 separate days, about 3.5 to 4 hours each day. Sometimes that's within the same week. Sometimes it's over 2 weeks, depending upon my schedule and their schedule. And then I have a very quick turnaround on reports. So I meet back with the parents the next week, and the report will be ready at that time. Because I know as a parent, I don't want to be sitting there waiting for those results. The anxiety that would cause wanting to know what's going on with my child. So it's a priority for me to get that report ready for the parents. They come in the following week. We sit down for an hour and a half and go through the test results. So it's done over about maybe 2 to 3 weeks, unless now in summer the family's out of town and they're not available for the feedback. And I will give the child age-appropriate feedback too along the way, but they don't come in for the feedback.
Yeah, because there's really no need to kind of help have them think that they're broken, or they may perceive that there's something wrong with them.
Exactly.
There's a lot of planning that goes into this, and it's just really the way a child learns. I mean, it's not that they're broken, that they're different. I mean, they may see things the world a little differently. They may understand language and words and hear things and see things differently.
Right, and that's such rich information that you can share with the parents and explain to them how the child sees his world, whether it's because of a neuropsychological deficit, more neurocognitive, or more psychological. That's the issue.
So they come in, take the assessment, you go over the report. If family has the report, what happens at that point?
At that point, I would make the referrals to wherever they need to go. And I prioritize it because I know it's overwhelming for them. They sit, they get all this information, and then they're like, what now? I want them to have the tools. So first, you need to go contact a psychiatrist. And here's 3 names, and I would trust any of them. And this is what you're going to talk to them about. Give me a release. Let me talk to them ahead of time too. The second thing is, the child needs an occupational therapist. This is why. This is what needs to be worked on. These are people that I would recommend. Or we need to make a meeting with the school. Or we need to pull the child from the school. And here's 2 schools that would be an excellent fit. Give me a release. Let me call the director of the school so they know what it is that your child's struggling with. And we can see if there's a spot for your child.
So it's a diagnosis, and then treatment comes afterwards. Treatment recommendations, and then they go and they follow up, and the changes start to happen.
Yeah, and sometimes it's just life-changing for the child. One evaluation lasts up to 3 years. So if a child's tested, and they're getting accommodations, they'll need to be retested in about 3 years' time, unless there's something we're tracking more closely, something more serious, and then maybe a year or two we'll retest. But that evaluation, those results are valid for 3 years, and sometimes the child does not need to be retested if in 3 years' time they're doing fine. But if they've requested special accommodations at school, then they'll be back. And sometimes it is mind-blowing to see the progress that a child has made as a result of the intervention.
It's really gratifying to kind of see that there's been improvement and they're feeling better and they're functioning better. What ages do you test?
I start at age 3, and those kids are generally kids who are autistic spectrum disorder or more language delay, sometimes more sensory issues that I'll see at that age. And then I go up to young adulthood. So college students, I see kids who've been at private school in Dallas, have done really well with so much structure and help, go off to college and crash, and then they'll come in for an assessment so we can see, well, what's underlying this?
And do you test adults as well?
Preferably not. Sometimes I'll do it if there's a particular reason, but I just love working with kids. I love kids. Yeah.
I mean, and you're really gentle and really sweet and genuine. I think that you'd be a really great professional to work with and very easy to talk to. We're visiting with Michelle Luery from Pediatric Neuropsychology Services. We're going to take a quick commercial break. We'll be right back after these messages.
This is Pete the Fast Freak, host of Race Talk, the motorsports talk show, heard every Sunday live from 4 to 6 p.m. right here on Talk Radio 1190. When the races are over, we're just getting started with the latest news and results from NASCAR, NHRA, the IndyCar Series, and what's going on right here in the Dallas-Fort Worth racing scene. So join me, Pete the Fast Freak, every Sunday live right here on Talk Radio 1190 from 4 to 6 p.m. for the latest in the world of motorsports. And remember, keep your racing on the track, not on the street.
Look, you can't go a week without hearing how the Ford F-150 is way ahead, leaving every other truck choking on its gravel. And when it comes to safety, the truck that leads the pack is the high-strength military-grade aluminum alloy body Ford F-150. F-150 is the only pickup to earn both of the most important safety awards in America. First, it earned the government's highest overall safety rating, 5 stars, for all sides and all cab configurations. And now, F-150s earn the IIHS top safety pick on Super Cab and Super Crew with optional forward collision warning. The competition? Yeah, right. Just don't ask for both safety awards, because that ain't happening, pal. Let's review. F-150's the only pickup to earn both awards, once again raising the stakes for what a truck should be. This is the safest Ford F-150 ever, and every other truck is history.
Government 5-star safety ratings are part of the National Highway Traffic Safety Administration's new car assessment program. Tests include driver and passenger front side and side barrier pull tests.
5, 4, 3, 2, 1. Ringling Brothers and Barnum and Bailey presents Circus Extreme. Get ready to experience extreme family fun like never before at America's most extraordinary live family entertainment experience, the greatest show on earth.
Brought to you locally by Metro PCS. Tickets start at $15. Opens August 3rd at American Airlines Center and August 18th at Fort Worth Convention Center. Tickets are on sale now.
Every day, millions of Americans are putting themselves at risk just by writing a check using a credit card or an ATM. We're talking identity theft. And if you've been a victim or think your personal information has been compromised, you need to act immediately. The identity theft recovery process can be long and daunting, but you don't have to do it alone. Contact a certified counselor at the National Foundation for Credit Counseling at 1-800-388-2227, who can guide you every step of the way. This has been a public service message from the NFCC.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, we're back. Excuse me. You're just joining us. We're visiting with Michelle Luery from Pediatric Neuropsychology Services in Dallas. I want to kind of talk a little bit about myself and something that I actually struggle with myself. And I've been diagnosed with ADHD, inattentive type. And prior to me really understanding, how I really understood the world and where my thoughts were going, my thinking would kind of drift off. I would be thinking about something else while I was actually present to something like a lecture or watching a movie or something. And then over time, I actually learned to harness this. Let's talk about ADHD. What do you see with ADHD and the diagnoses of ADHD?
Mm-hmm. Well, I do think it's overdiagnosed somewhat. I think so many children come into my office, the parents are convinced the child has ADHD or the teacher thinks that. Very often there's other conditions that have the same symptoms, such as anxiety, and that's a big thing to tease apart what's anxiety, what's true ADHD, or what's both. Mm-hmm. But part of what I do is look at the child's attention and response control and seeing how they do when they're working independently, self-regulating, completely without me there, or when I'm with them, one-on-one. Is there a difference? And very often there is. I look at visual attention, visual selective attention, auditory attention. Can they screen out stimuli? Are they impulsive? Response control. And those tasks, actually, most of them are really fun, and the kids enjoy them. Now, I do a continuous performance test on the computer where the child's sitting for 15 minutes on a monotonous measure of sustained visual and auditory attention. That's not such fun for them.
Yeah, I mean, that would be like kind of an attend over time type of measure.
That's right.
And you see if there's cognitive exhaustion or distractibility
Exactly, looking
factors.
at their stamina, their distractibility, vigilance, yeah.
Are you familiar with evoked potential responses?
I've learned a tiny bit about it, but not something I've really used.
What they say is they can actually predict when somebody is about to have a distraction moment because their eyes will shoot up and then their head will kind of move off. And so I remember they were doing this kind of testing over at the Shelton School in Dallas, and they had like this cannonball, it looked like a cannon, facing a child in front of a computer, and they were wearing this little cap with a little ping pong ball on their head.
Yes.
And they would actually they would try to measure these evoked responses.
Yes.
Really interesting science, but just trying to really get more information on the distractibility component.
Yeah, but I do think it's really important to, whichever way you're going to evaluate it, to make it a very thorough evaluation of attention, to make sure that that is really what the issue is.
And you probably hear a lot of over-diagnoses of ADHD. Everything seems like ADHD.
Yeah, and parents complete a rating scale at the pediatrician and then get onto a stimulant. But there's no way of knowing if what you're measuring what you think you're measuring. You really want to make sure that diagnosis is accurate. Now, children can have executive functioning issues, which is more of a frontal lobe deficit.
It's completely different from ADHD.
Yeah, and there's an overlap. Kids with ADHD very often have executive functioning deficits, such as problems planning, organizing, self-monitoring, difficulties with working memory, starting tasks, staying on task. So the initiation and then persevering with the task. But not every person who has those executive functioning deficits has ADHD.
Oh, interesting. So it's really about executing tasks and really sustaining these functions and being able to kind of bridge the gap between cognitive demand and then your output.
Right.
But there's a disconnection there, and it's not ADHD.
No, and the child can be highly functioning in terms of in a very structured environment where they've got a mom or teacher to help them to sign off on their homework book, to make sure that they're taking the right books to home, to school, making sure they're putting their stuff in their backpack.
Michelle, when did that concept come around, executive function disorder? Because it hasn't always.
I've always had that as part of my training.
Really?
So, yeah, because when I was first trained, the Neuropsych battery that I was interested in was the NEPSI. And there's a huge component there of executive functioning. So to me, it's always been how I've looked at a child. But your executive functioning can be measured from the time you're a tiny little kid, but it's only fully developed in your early 20s. So
yeah, because the frontal lobes are the last region of the brain to develop.
Exactly.
Correct. Yeah. That's why it's kids that are like 15, 16 really have the mentality of a 12-year-old.
Yeah,
sometimes.
that's right. And you've got to, that's why you see 16-year-old drivers, and you sometimes are like, talking about my daughter who's almost there, and yours.
I know, and they're just really big kids. I mean, because emotionally, when I visit with Haley, she's the same way. She's I can see the small child in her, but she's almost as tall as my wife. They wear the same shoe size.
Yeah. Oh, my daughter's taller than me now. Yeah.
Well, you know what's interesting? I was actually walking through the grocery store the other day, and I had this thought. I snapshot a picture of, on every aisle they give you a little descriptors of what's there. There's bread, baking needs, and I was thinking, that's a very abstract concept. There's no way that the entire aisle has 4 of those objects, 4 of those products. But then what it's designed to do is use your ability to kind of think abstractly that, okay, well, if it's kind of within this arena, you're likely to find it.
Okay, so that's called categorical reasoning.
Okay.
And that is something that I test.
And
that's
kids,
part of it.
Kids typically don't have that ability.
They have an age-appropriate ability.
Like a Piagetian, correct?
Right,
The sensory motor, and then you get to the concrete operations and formal operations.
And so you want them to be developing at the correct stage and have those skills for their age and have realistic expectations for them too. One of the things that often comes up is what can we do for executive functioning deficits versus ADHD? And, kids with ADHD, very often they're on stimulants and this is something you know more about than me, biofeedback.
Yeah.
Executive functioning deficits do not respond to stimulants if the child does not have ADHD. Then you need different type of recommendations, different type of interventions. And most often I would recommend a learning specialist or an executive functioning coach.
To be able to train the skill.
Exactly.
And that's what we do with neurofeedback or EEG biofeedback.
Yeah.
For the longest time, it's been, the redheaded stepchild. It's been kind of off, and nobody really wanted it to kind of be part of the biofeedback arena. It was always looked at as hocus pocus and just kind of energy from the cosmos because it was smeared in the early 70s. But what it's designed to do is, you place a probe, a little sensor, on a region of the brain that has a certain function. Like let's say there are certain regions of the brain that are responsible for mood control and impulse control, some that are concentration, others that are visual processing. You have your Wernicke's area. You have your math and auditory, and you have your temporal lobe function. And so what happens is we administer what's called a Quantitative Eeg Brain Map, and we take a snapshot from 19 different sites of the patient. We plug it into a normative database, and that's a collection of maps, similar maps of individuals who are considered normal. Average IQ, no known diagnoses. And then we superimpose, we plug in their birth date, it pulls a collection of maps that are appropriate to that child, and then it superimposes the map over the others, and we see the differences. And so we say, okay, this looks like this area here is affected. This is where the attentional and your impulse control and your mood stability is. This, when you have excessive activity there, that's usually associated to anxiety. So what we do is we place a sensor right on the little map where it's actually identifying where the difference is, and then we teach them skills. We teach them how to use breathing techniques, body techniques to relax themselves. And what happens is once the body slows down, that region of the brain will actually regulate. It'll actually go back to its normal function. And so then that sensor is picking up the activity there, and then beep, 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 they'll push a little race car around the screen, and it's followed by these beeps. So it's actually a training process. And so, it is a skill that you can actually teach.
And does it generalize to everyday life? That's always my question.
And that's what our particular center is. We have a stress gym, and it's designed to kind of, give them tasks. There's focus skills. There's time tasks, and they're working under pressure and with stimulation, so they have to overcome like the distractions. And so we're coaching them, and we have cued responses, and it's a very private process. I mean, we're not saying, hey, use your biofeedback, use your focus skills. These are usually like, very coded strategies like 15-4 or EEJs. And so that means eyebrows, ears, and jaws. And so that is a technique that they were trained with in the room, and then they generalize it and they apply it in a real environment. Because I think that in my field, the biggest issue has been an over-reliance of dependence on electronics. So they're saying, well, according to these graphs, the child should be better. But I equate that to trying to explain to a child how to skydive. And first, in my office on the couch, I say, okay, first, like you put on your little pack, you zip it up here, and then you walk up to the opening of the plane, and then you jump. And then you look at this little watch, and whenever the little arm gets to the green, you pull this little cord, and then you're skydiving. Do you got it? You understand how to skydive? And so then we say, yeah, I have it. And then so we boost their confidence of being able to go and do this. But then when it comes time to actually use it, there's no real way. I mean, almost 99% of the time, they'll resort back to their original reactions, their original avoidances, original behaviors.
Right.
Parents are there saying, hey, use your techniques. And they're like, it doesn't work.
Yeah.
But, what you're contending with is you're facing the anxiety, you're facing the difficulty. And now you're relying on the child to have courage on their own to do these things. And it doesn't work a lot of times. And so,
do you think your interventions work for little kids too, or only for adolescents who can who can think about their skills?
Well, no, because there's two types of training. There's operant conditioning, which is where we're explaining it and we're kind of saying, hey, reasonably, this is how you want to use it. And then there's classical conditioning. So we're actually conditioning the responses. We're conditioning the techniques.
Mm-hmm.
And so then whenever they use a breathing technique, the body responds.
Right.
I always equate it to like, hey, we're training the body. It's like a big dog.
Oh, I love that.
And so then, anytime they use a strategy, then the function will actually kick in, and that's classical conditioning. So, but we coach the parents, and then we teach them to be, therapeutic partners at home. But it works really, really well. But we just got onto a tangent.
Yeah, but that's great because that is, I always make this recommendation.
Yeah, well,
so
and I would appreciate it. Yeah, it's very different. I think a lot of people don't know it. But back to you, how can people find you really quick?
You can find me online, pedsneuropsychology.com. You're welcome to call the office, 972-248-3682.
Michelle, Luery, thank you so much for being on the show. Enjoy your weekend. Thank you so much for joining us. Have a blessed day. 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 Have a blessed day.